Dr. Zamboni. My name is Kathleen, and in 2010, I went to the only ultrasound technician in Seattle who was trained in Zamboni protocol. My sonogram showed reflux and stasis, and the technician said to me, yours doesn't quite, the numerical value doesn't, it was just below the criterion. And then she said, I don't know why he chose these numerical values for the criteria. So my question is, how did you come up with the numerical value of when reflux becomes CCSVI?
This is a very good question. The numerical value were derived from what was known at that time in terms of physiology. We have few papers at the beginning of 2000 when I started this kind of investigation. We really have very few papers showing us, for example, that was never measured a reflux more than 0.8 seconds. So when I proposed, for example, this numerical value, I referred of references in literature. References show that the back flow in the reason of the valve was in an interval between 0.5 and 0.8 seconds. So the proposal was at the time to consider reflux when the backflow was longer than 0.8.
With the recent discovery of lymphatic drainage of the brain, I haven't heard anything in this conference or in any of the presentations so far about the healthy condition or the MS condition or even in zero gravity. How significant is it? And if we equate cardiac output and units per charge, how does the lymphatic drainage of the central nervous system in the brain specifically affect these conditions?
This is a very important question for your opinion. Thank you very much. I think that the discovery of the renewed theory about the lymphatic drainage of the brain is very important for two reasons. One reason is that means a revision of the compartmentalization of the brain. So the brain is not so isolated from an immunity point of view. It's a vulnerable organ like the other because there is a connection of the immune cells with the brain. But it's very interesting also that the investigators clearly found that one terminal of the southern skull of the lymphatic system are the deep cervical lymph nodes. This is very important because these lymph nodes are satellite of the jugular vein, and there is lymph-venous connection because the terminal is the thoracic duct. The thoracic duct is in the region of the jugular vein, and there is a gradient of drainage in time between the lymphatic nodes and vessels and collectors and the jugular vein. So if you should have a good gradient of pressure between This is very important. But if you should have a right pressure on a not good grade in the jugular vein, the drainage of the lymph will be less efficient. And this is really an exciting chapter that needs further research. Very, very exciting, very important chapter.
Ciao Paolo, Ivo Petrov speaking. I'd like to congratulate you as always. You are on the top of the way. And really this research is extremely interesting for all of us that are with you in this field. I'd like to ask you what you are presenting now make me think about a more objective criteria before and after the treatment about improvement of flow. And in case, as you mentioned, not everybody is improving after the balloon angioplasty, and most probably one of the reasons, maybe the main reason, is improvement or not improvement of the flow. And this can be the most subjective criteria about the result of the treatment. And if we correlate with the clinical results, it would be really a huge step ahead about improving the results. What do you think about?
Hi, Ivo. Good to listen from you. This is a fantastic question, really. I think it will be very important to compare, for example, in terms of treatment, the jugular venous pulse before the treatment and after the treatment, but including also some evolution from the interventionalist. For instance, if we may have in intervention, in procedure, the same kind of measurement, I consider very interesting the clearance time of the rule or something like this that is numerical. We may compare pre and after the clearance time of the contrast time with the JDT. This is fantastic for the follow-up because at that point, by using the simple JDT measurement, we may have a comparison with the clearance time at the time of the procedure, and so we may follow up very well people, and only when there is a return to critical JDT, ultrasound JDT, we may propose eventually the catheter again. But if the people should have a good, satisfactory jugular venous pulse in terms of gradient of pressure, flow rate, and other parameters, there is no need to check or to redo surgery or intervention.
Are there any other questions? Doctor?
Yes. Is there any way to artificially stimulate the jugular venous pulse?
I don't think so, because this really is physiology. And for example, if you should have an increased heart rate, there is an adaptation of the jugular pulse to the new rate of the heart. So this is very important because the jugular pulse cannot be easily modified. Also, I add that if you take a video clip with something wrong, it's very easy to understand that technically the video clip was not correct. And so the examination is invalid. And the post-processing is practically reproducible to everybody. because it's mathematical. And this really increases the objectivity of the diagnostic system. I think this really may be a very important thing for people and also for a rewrite, I think, the epidemiology of CCSDI.
Thanks very much, Dr. Zamboni. Bill Codier. I've been lucky enough to see some of your representations of plethysmography of the neck, of course, as far as brain. And so does this information assist you in that development, or does it kind of make it unnecessary? What's your suggestion?
No, I think that you are right. In the space, you use also the plethysmography. My problem is that we need of a special chair to use the plethysmography on the heart. And the special chair is a chair that needs of certification that are really not very easy to have. Because you change position through the movement of the chair in less than 2 seconds, you move to supine to a breath. This is the test. And the device really needs of a difficult certification path in order to be available by everybody. This is really a simple test, very objective, and could be usefully coupled with the new ultrasound investigation to have really a screening device very useful for people. We are looking for companies that with the intention to develop the plethysmography and the mobile chair with safety certification from the European Community and the FDA as well. But it's not so easy to do. To the contrary, the system that I showed you today needs of widely spread equipment, such as good ultrasound equipment with possibility to have connection with electrocardiogram, synchronized with the imaging, and with very good frame rate for seconds. But these are instruments that are practically present in all the hospitals and in many of the outpatient vascular nerve labs in the world. So it's more ready with respect to the smart.
One more question, Dr. Zamboni.
Hello, Dr. Zamboni. It's not so much of a question, but I was wishing to share a paper by one of your countrymen, Functional Neurology 2000. It's called The Dopamine Involvement in the Migraine Attack by Alessandri Fanciulacci. And I have always been interested in the connection between the people who have severe migraines and also my MS patients. And so anyway, since I have you here, I just thought I'd give you that name, Fanciulacci, Alessandri.
Thank you very much. I think that, we used the MS model at the beginning because we needed to start from somewhere in the study CCSDI. However, the connection between CCSDI and other neurological symptoms or with neurodegenerative disorders now is more clear, and maybe more investigation will give us the complete picture in the next years. Headache, migraine are also symptoms of people affected by MS and also from other neurological disease. And I think that venous dryness could be really considered in case of migraine between the possible points to be investigated. For this reason, I consider that to have simple screening methods to be included in the investigation of people with migraine, such as the jugular venous pulse, ultrasound assessment, or the plethysmography, or something like this, cost-effective and non-invasive, will be very important for people with different symptoms, also including other neurological diseases, such as, for example, Meniere disease or other neurological disorder. Really